My name is Dr. Olivia Moses, and welcome to Wellness Live. We're excited you've joined us today. This entire series is brought to you by the Loma Linda University Living Whole Wellness Program. Now, today we're going to be talking about autism. You might have seen a lot of articles in the news and maybe even some celebrities talk about autism, but we want to make sure that you know what is the truth and what might be misinformation. So today we've asked our resident experts in autism to come join us. We have Dr. Krishnamurthy and Dr. Pishan Zentil come and talk to you today about autism. So without further ado, Drs. Pishan Zentil and also Dr. Krishnamurthy.
It's our pleasure to be here. I'm Dr. Pishan Zentil, and this is Dr. Krishnamurthy. And I'll start by asking Dr. Krishnamurthy, what is autism spectrum disorder?
So it's great to be able to talk about autism this month, as it is National Autism Awareness Month. So in talking about what autism is, I just want to first talk about the fact that it is a very complex neurodevelopmental disorder. What I mean by saying it's a neurodevelopmental disorder is it's something that you actually have at birth or close to birth that follows along through your lifespan. It's not something that can get cured or can get addressed, to get cured or to be eliminated, but it is something that we have a lot of information about, that we have the interventions to be able to help children and adolescents deal with the symptoms. So it is a complex neurodevelopmental disorder. It's got symptoms that have changed over time in terms of what the diagnostic criteria are, but there are some core features of the condition that we will talk about. The other part I do want to bring up is it's a spectrum disorder. And by that I mean not everybody who has the diagnosis presents similarly. So if you see one child with autism, you're really just seeing one child with autism. They don't all look the same. So in talking about the core features of the diagnosis, we really see symptoms along three areas. We see symptoms that look at how the child communicates with other people, both in terms of verbal information and nonverbal communication. So by verbal, I mean, do they use words to be able to communicate what they want and need to others? Do they have a conversation with other people? Can they let other people know when they need to do something? And then by nonverbal communication are things like, do they make eye contact? Do they have facial expressions? Do they smile socially at another person? Do they use gestures, pointing? So nonverbal strategies in order to communicate with somebody else. The second part of the diagnosis we look at is social interaction. Can they have a back and forth exchange with somebody else? So can they hold a reciprocal conversation? Can they play interactively, or do they do more parallel play with each other rather than playing together? We also look at how they read social cues, when to start talking, when to stop talking, when to move away from a social interaction. So we've got communication and then we've got social interaction. Those are two components we look at. And then the third component that we look at in terms of autism are the stereotyped or the atypical behaviors. So these are things like, do they have any stimming behaviors like motor mannerisms, hand flapping, rocking, spinning? We also look at things like, do they echo what other people say, or do they script from TVs, movies, jingles? How do they play? Do they actually have functional play, or do they just line up objects? Other parts that we look at include things like how do they transition and change from one routine or activity to another? Do they have any odd fixation or pattern, unusual areas of interest that they present with? And then last, of course, are the sensory issues. Do they have sensory sensitivities? Do they seek out sensory information? So these are all symptoms that we look at when we think about whether a child has autism. Most of the time when parents come in, the most common symptoms that they come into the clinic with to ask about whether their child has autism is really, they don't have words, they're nonverbal, they don't make eye contact, they don't try to engage with other people, or they do odd atypical behaviors that the parents can't explain. So these are some of the symptoms why parents come into our clinic to really ask about whether the child has autism.
What is the age of concern for autism?
So as I mentioned, autism is a neurodevelopmental disorder, meaning that symptoms we really should be seeing when they're about 3 years of age. We should be seeing those symptoms present prior to then. But sometimes children are not in environments that actually seek out those symptoms. A child may not be in school and may not need to have the reciprocal social skills. So we may not be sure that they have autism until they're in an environment that demands those skills. So yes, we want to see majority of the symptoms present by the time they're 3, but sometimes there are other issues that come up as to why we may not be able to diagnose until they're older.
What consists and what is the basis of your autism evaluation?
So we tried to follow the Google standard of what an evaluation should look at in our clinic. By the gold standard, I mean there are certain components that we feel are absolutely necessary if you're going to make the diagnosis. Part of that is having a parent interview of their current concerns as well as the child's development, medical, social, academic, etc. We also look at their cognitive and adaptive skills to see what they're actually able to do. We look at their language skills in terms of understanding what they're able to understand and what they're able to produce language-wise. We look at their behavior. We look at their sensory functioning as well as their gross and fine motor skills. And then we look at autism-related play skills and how they engage with other people. And on top of that, we really look at a medical evaluation to make a determination as to whether there are any organic causes that could be contributing to or explaining some of the symptoms that we're seeing.
What drove the establishment of the Inland Empire Autism Assessment Center?
So there are multiple reasons why the clinic was developed, but the primary, I would say, is because there were so many different agencies that were involved in caring for the children who are on the spectrum. And a lot of times there wasn't a whole lot of communication between the different agencies that were doing the evaluations and the treatment. So we wanted to create one central agency that would do the evaluations where the results are recognized by other agencies, and then will help determine what treatment recommendations the child needs.
And who were part of the collaborative?
So we've had multiple community agencies who are stakeholders in the collaborative, Loma Linda being one of the primary ones who were there to develop the clinic. IHP, Inland Empire Health Plan, was another big source for us in terms of developing and creating this program. Other community agencies include the Regional Center, Department of Mental and Behavioral Health in both counties, the school systems in both counties, and Autism Society, which has been a great parent advocacy program.
What makes the Autism Center unique?
So I think what really sets us aside is we use a multidisciplinary team approach in doing the doing the evaluations and and coming up with the diagnosis. So on our team, we have physicians, Dr. Pichon being one of our neurologists. We have a developmental pediatrician. We have psychologists, geneticists, speech and language pathologists, occupational therapists, behavioral specialists. So we have a full team that are involved in really assessing the child and determining what the appropriate diagnosis is and the treatment plan.
Can you walk us through the assessment for each child?
So we do 2 levels of evaluation at the center. We do what we call an initial evaluation, and this includes obtaining parent information regarding their concerns and the child's development. We do a developmental screener to understand where the child is functioning. We do a rating scale of autism to see what symptoms they're presenting with, and then we do a play observation to really see what the child is able to do. We also try to eliminate other symptoms such as trauma and other things. So this information really gives us a good conceptualization of who the child is and whether there are really concerns for autism that we need to evaluate further. If they're not, we can determine what's going on and send them to community agencies that may be a better fit for what services they need. And then the children that we do feel need the full evaluation, we do what we call a complex diagnostic evaluation. And this is when the child is seen by the entire team, including the physicians, the psychologists, the occupational therapists, the speech and language pathologists. So the full team evaluates them and they go through this evaluation process. At the end of the day, we actually as a team meet to review the results of the evaluation and really determine whether the child meets criteria for autism or whether there's something else that's going on. We also determine what the interventions and treatment plans the child needs at that time. And then we provide feedback to the family going through all of the results and the diagnostic information. So one of the questions that I've been asked frequently is, why is there a need for the complex evaluation? And really the primary thing is the diagnosis is complex. There is no litmus test that tells us a child has autism or not. So we need the expertise of the clinicians doing the evaluation to really determine whether they have autism or not, and what treatments and interventions are actually needed. Because there is a number of diagnoses that present similarly to autism, and we really need to be able to distinguish between children who truly have autism and children who have social deficits because of one of these other issues. The other part to that is some of these diagnoses are coexisting along with autism. You could have a child who has both autism and ADHD. So we need to be able to distinguish those children as well. So we really need that complex evaluation to be able to do so. And really what we need for a complex evaluation is time, to be able to spend time with the child and understand what they need. We need to give them opportunity to show off what skills they have. And really we need the team approach to be able to determine what the child actually is going through. Okay, so these are some of our hopes for the clinic over the long term. And as we've had over 150 children that we've seen so far in our clinic to date, we wanted to go through some of the common questions that parents ask us. So I'm going to turn this to Dr. Pichon to be able to answer those questions.
So one of the most common questions that I get from parents is, my child has a diagnosis of ASD. What's next for my child and my family? I always tell them that the medical evaluation has been done. However, there needs to be a follow-up by the physician. So I do ask some of my patients to come back to see me in the neurology clinic, and their developmental trajectory has to be followed. So they need to be monitored by a physician. And the regional center is a great resource for early intervention services, case management, and long-term care. The school, as the child transitions from 3 years old, after 3 years old, then the school would take over. So we urged families to enroll their children in school because there are special needs preschool and individualized educational plan evaluation that they can obtain. Therapies. So some children require speech therapy, language therapy, and occupational therapy. So I do recommend that, and the parents have to take their children to the recommended frequency of the therapy. Behavioral resources. So some children need ABA therapy or floor time or parental initiated speech interaction plans. And another thing that some children do need is mental health services. So sometimes we do recommend family therapy, individual therapy to address mood and behavior. And if appropriate, we do recommend referrals to a psychiatrist who can evaluate the children for possible medication initiation and follow-up.
So we also get a lot of children who we don't diagnose with ASD. What is your advice on what to tell them?
So I always tell the parents, if it's not ASD, I think it's a good thing, and we need to find out, then what is it? So the next question that we do answer, what other diagnosis can this child have? So we need to address the actual medical condition that the child was diagnosed with, and go with the treatments and interventions that your physician recommends. And this always depends on the child's needs. So let's say if a child has a language delay, then pursue speech therapy. If there are behavioral issues, then we do recommend individual and family psychotherapy services. If there are motor sensory processing issues, then we seek the help of our occupational therapy services.
So this is a common question that we get. So parents often ask, why my child? Why does my child have autism?
I always emphasize to the family that just because your child has autism, you should not blame yourself. So even in this day and age, 2017, we do not know what causes autism. Research have shown us that there are genetic factors and environmental factors that may predispose children or maybe risk factors for autism. However, the bottom line is we do not know what causes autism. So I urge you to go to the Autism Speaks website, and they have a list of possible risk factors for autism. So as an example in this slide, I will maternal and paternal age is a risk factor, for example, and what can lower the risk factor. Something as simple as folic acid before pregnancy, during pregnancy, is known to lower the risk. And what does not what is not a risk factor for autism? It has been proven by hundreds of research data, both here in the US and abroad, that vaccines do not cause autism.
What if I don't agree with the diagnosis that you've given me?
That's a very hard question, but I think it is fine to ask for a second opinion, if needed, a third opinion. But I do believe that if two or more appropriately, adequately trained professionals have given a certain diagnosis, then such as autism, then it may be time to take the next step. So look for the services, the appropriate services that your child qualifies in that we are recommending. Look for the appropriate intervention, because we do know that in autism, early intervention is key.
We have a number of children who are moving into adolescence with the diagnosis of ASD. What should a parent's expectations be of the child as they move into adolescence and then adulthood?
So number one, if they were diagnosed appropriately with autism, then given the correct interventions, the appropriate interventions for their child, the symptoms should reduce, the skills should develop, and they should be more interested in socialization. Interventions should have had a positive impact on their functioning. But there really is no crystal ball where I can predict the future of an adolescent and what kind of life he will have in adulthood. But the key to better outcome is providing them the opportunities and tools to develop their skills.
And what services are available for a child with autism as he moves into adolescence and adulthood?
I always emphasize this with the families, that the regional center is key, because they are equipped to guide your child as they transition from adolescence to adulthood. They have case managers, they have transitional services, and they have vocational training and supportive employment, and they could also assist you in conservatorship or day programs. Another resource would be college programs from our state schools, from our community colleges, who can help our children learn adaptive skills, plus how to thrive in a supportive academic environment. I cannot emphasize the role of adult providers like our internal medicine physicians, the family practice physicians, the adult neurologists, who are key in the transition of the medical care from childhood to adulthood. So I urge the pediatricians, and I do this myself, to communicate with these adult providers in arranging for the transition of care. Sometimes some of our children get too big and too strong for their families, and they do get aggressive. So at that point, I start the conversation for residential facilities for the family. And they have been key in helping my families who struggle with an aggressive child. It's very important to remember that public safety for the family as well as the child with autism is key.
If our insurance doesn't cover services, what are the options?
As a physician and as a patient myself, I always advise everyone to have a relationship with your providers. They will become your advocates. So if they need to appeal the process, any test that has been denied by the insurance, then they will do it for you. They can justify what they ordered. They can justify the services. If necessary, you can find an ethical and an experienced advocate.
What about alternative interventions such as chelation, hyperbaric chambers, food diets, etc.?
So that's an excellent question. You can go on the FDA website for consumer safety, and they do list the therapies that was just mentioned that are considered unsafe and lack evidence to help children with autism. These are expensive, some are dangerous, and they are not evidence-based. So as a physician, my recommendation is to live a healthy lifestyle, eat well, sleep well, and this is true for my children, for my patients with autism, as well as the parents, and live well.
And you mentioned that there is no evidence linking vaccines to autism. Can you tell us a little bit more about that?
So there is the American Academy of Pediatrics has a list of all the research articles and the studies that have been done to disprove the link of autism with vaccine. There is no link between vaccines and autism. So the recent outbreak of measles due to some children not being immunized, I think is an illustration of the compromise of public safety because of these fear. There are multiple etiologies to developing ASD, and I show here the redacted article from Wakefield that has been quoted by some of the vaccine advocates or people who think that there's a link to autism. So as you can see, this article was taken out from the Lancet because it was not evidence-based. So this is the referral process to our clinic. Usually the pediatricians would refer the patients through the insurance company, and the parents are the best advocate for their children. So they talk to their pediatricians, and if they have any concerns about autism with regards to their children, then they have to advocate for them with their pediatricians, and they go through the referral process and they come to the Autism Center. We need all hands on deck to sail the ship of humanity, and that is what guides us in the Autism Center.
Well, thank you so much for your presentation. We have some really good questions coming in, so let's get to the questions. So the first question is, traveling with my autistic child is difficult. What can I do to make going out easier? And you probably get this question quite a bit.
I do. One of the things that I recommend for families is practice. So even with children who need, let's say, an EEG done or an MRI done or just going out to the store, the children with autism are very good at routines and they're very good with repetition. So I ask the parents actually to practice it for a week before they do certain activities. And the children learn and they get better every time they do it.
Practice is great, and one other option I would recommend is having something that may suit the child. So a lot of children with autism have things that they do to calm and self-regulate themselves. So having a tool or having something that's familiar and comforting to them that helps them self-regulate could be another resource in addition, and actually in combination with the practicing activities that you want regularly to improve their skills.
Wonderful. So another question I have, and sometimes these families are multiple child families, and that's where this question comes. Do siblings suffer increased stress as a result of having an autistic brother and sister, and how do you address that?
So this is where the genetic component of the etiology of autism shows. Studies coming from UCLA, institutions like Yale, for example, they have shown that there is an increased risk for siblings, even as high as 25%. So I think if one child has autism, then usually the parents are more aware, and so there's early diagnosis, and the key would be early intervention for these children.
And to add on to that, I think the other part is it is difficult having a family member who has autism because it does impact your day-to-day life. You may not be able to go to the places you want to go to. You may not be able to have friends over to your house. You may not be able to do the things that most typical families are able to do. And it's important for the siblings of children who are on the spectrum to have that acknowledged and to have that addressed in some way, whether it's maybe some specific times with the parents alone, whether they get a specific activity that they do by themselves where the other siblings are not involved in. So something that gives them attention, that gives them some comfort, or where they're the special person in that field. They need those activities, they need those scenarios to be able to really address a lot of what they're going through. In addition, there are a lot of sibling support groups. We see this with siblings who have other we see this with siblings who have siblings with other medical issues, but we also see this frequently for siblings who have a sibling who has autism. So those support groups, either online or in person, could be very helpful for them to be able to cope with what they go through day to day.
That's wonderful to know. We have another question, and the question is, my child is 3 and not talking yet. Does this mean he has autism?
What I would say is not necessarily. Not talking is one of the indicators, but you want to look at how they're actually communicating, because we communicate a lot, not just through words, but we also communicate through gestures, hand movements, eye contact, smiling. All of those are also involved in how we communicate. Whether the child is on the spectrum or not, we still need to evaluate a child who is 3 and is not yet talking. So going through a comprehensive diagnostic evaluation or a speech and language evaluation may be a good first step to really understand where the delays are and whether the child could potentially have an autism spectrum disorder.
Okay. Another question is, what is the difference between autism and Asperger's disorder?
So in the DSM-5 criteria, the most recent, it's kind of like the Bible for a lot of this psychological psychiatric disorders. There is, the Asperger's disorder was taken out. So it is what was known as PDD before, and the Asperger's, they're all now under the autism spectrum disorder category.
What I would clarify is there are some differences. Mostly, Asperger's tends to be a milder version of the diagnosis, and sometimes it's more of a personality issue or a personality type of diagnosis than autism is. But we don't use the terminology Asperger's, but generally when we do have a child where we're suspecting, we say they have a mild form of autism.
Okay. Now, what would be your advice? I do not live near your center. Who can I talk to?
So depending on where you're living, one of the first sources, and depending on the age of your child, the first source I might look at is the school system, because every child is going through school. So the person I might talk to is the school psychologist at school to see whether they have any concerns, the teacher, the psychologist, whether they have any concerns. If they're not saying any concerns, maybe they don't. Another resource I might look at is your pediatrician. Most pediatricians screen for autism at 18 and 36 months of age, but they can also do it at other times, so they can talk to you about what symptoms you're seeing and whether they're consistent with autism. Another source, Regional Center, has offices in other parts, and they are very familiar with the diagnosis. So these are some of the options. There are a multitude of other options that you can look at through some of the parent advocacy groups like Autism Speaks, Autism Society. They all have a list of resources in your specific area.
Wonderful. Well, thank you, Dr. Krishnamurthy and Dr. Pishan Zental, for being here. Now, we want to let everyone know that we do have an Inland Inland Empire Autism Assessment Center, where we here at Loma Linda staff that center. So it is the only one of its kind in the Inland Empire, and we would, if you have any further questions, we definitely want to refer you to the center. Now, how can they get a hold of you?
So we will post the website for the clinic as well as the phone number.
Okay, and then call them anytime, because this is definitely a diagnosis that you do not want to go undiagnosed, and we want to have interventions early. So hopefully this particular seminar has really helped you get clarification around autism and make it a little bit less scary when you're thinking about it. So my name is Olivia Moses, and thank you again for joining us. But before we go, I want to remind you that you can watch all of these seminars on demand at our website. All you have to do is go to livingwhole.llu.edu, and you can see all of our sessions just like this one on demand. And if you want to send this particular session to one of your friends or family, feel free to do so. Again, my name is Dr. Olivia Moses, and thank you for joining us.